Good morning. Welcome. Thanks everyone for joining us this morning. I see folks rolling in. Go ahead and get started. Thanks for joining us. My name is Tatiana Darby, Institute Manager at United We. Just a quick few housekeeping items before we dive into our program this morning. We will have time for questions later on. Please feel free as we go to pose questions in the chat to any of our speakers, and we'll follow up as we get to the question and the question portion of the conversation later this morning. With that, excited to turn it over to Wendy Doyle, President and CEO of United We.
Thank you, Tatiana. Good morning, everyone. It's great to be with you. Thank you so much for taking the time out of your day to join us for Caregiving at Work. As Tatiana mentioned, I'm Wendy Doyle, President and CEO of United We, and I'm thrilled to kick off the next installment of this series sponsored by AARP. Today's conversation focuses on one of the most defining workforce and economic issues facing Arkansas and our nation, which is caregiving. United We, just a little background, is a nonpartisan organization working to increase women's participation in the workforce. We work across Missouri, Kansas, Oklahoma, and especially Arkansas. We partner with state and local leaders to identify workforce barriers and then get to work to advance practical solutions. Caregiving is central to that work because it directly shapes whether people can enter, remain in, or advance in the workforce. In Arkansas, new data from AARP reveals that 630,000 Arkansans are providing unpaid care for parents, spouses, neighbors, and other loved ones. Care valued at an estimated $9.1 billion annually if compensated in the marketplace. With Arkansas's population estimated at just over 3.1 million residents and approximately 18% of the population aged 65 and older, that caregiving demand is expected to grow as more families find themselves balancing work and caregiving. There is some encouraging news, and that is that we are seeing growing momentum among employers, policymakers, and community organizations to better support caregivers while strengthening our workforce and economy. United We has been proud to partner with Arkansas leaders, employers, and community organizations on issues connected to issues ranging from childcare, caregiving, and workforce participation. Today's forum is an opportunity to continue building on those conversations. Our goal today is that you will leave with a better understanding of the challenges working caregivers face. You walk away with some practical examples of what employers and policymakers can do, and you walk away with some resources you can use or share within your own organization and community. We are so grateful to have a group of leaders joining us today to share about policies, practices, and vital resources shaping Arkansas's caregiving landscape. Today's conversation will move through several perspectives. We'll begin with the national caregiving landscape, then we'll move to focusing on what's happening here directly in Arkansas. We'll hear from state leaders, community organizations, employers, and conclude where policy is headed. To help set the stage, I'd like to welcome Lori Parham, Policy Principal at AARP. Lori, from your national perspective, what are you seeing at the intersection of caregiving and work? And why is this such an important moment for employers and policymakers to pay attention? Lori?
Thank you, Wendy, and it's great to be part of this important conversation today. AARP is very proud to be working with United We on such an important topic. You know, caregiving really is an issue that touches nearly every workplace and community, and we are really focused on supporting caregivers and ensuring that we work with employers to make sure that they can support their workforce. You know, across the country, millions of people are balancing their jobs while caring for a loved one. It can be an aging parent, a spouse, a neighbor, or a friend. I'm experiencing it firsthand, and I'm sure many of the folks on this webinar are as well. Wendy, you noted the billions in unpaid care each year that family caregivers provide. And these dollars are hugely important and reduce the demand on the formal care systems that can be really tough right now, especially as states manage difficult budgets. So caregiving is really vital to our families and the economy. And yet, so often caregivers are navigating their responsibilities without the support they need. And when caregivers are stretched thin, it just doesn't affect them. It impacts families, businesses, workforce participation, and community well-being. And so that's where AARP comes in, at least we're one of the organizations. We are also a nonprofit, nonpartisan organization. We advocate at every level of government, federal, state, and local, to advance policies that recognize the value of family caregivers and to ease the financial, emotional, and logistical pressures that they face every day. So from caregiver tax credits and paid family leave to ensuring that respite services are available in communities. We also work on workplace protections that help caregivers remain employed. And we work to ensure that caregivers have the support they need to care for their loved ones while maintaining their financial security and well-being and the well-being and financial security of their families. So caregivers spend most of their waking hours at work, which is why the employer space is such a critical part of the equation and the conversation. Beyond our advocacy at every level of government, that's tied to our outreach and education work. So we partner directly with employers to help them build caregiver-friendly workplaces. We offer tools. We offer cutting-edge research and best practices on flexible schedules, paid leave, employer resource groups, and caregiver benefits. And through initiatives like our Employer Pledge program and our work with businesses of all sizes, we're helping employers recognize that supporting caregivers isn't just good for families, it's good for their business. And when employers help caregivers succeed at work, they help protect a workforce that is essential to economic growth and business productivity. So, but leadership at the state and local levels is critical to this work, even though AARP is looking both at the federal level and across the country. And Arkansas is a powerful example of what's possible. As you noted, more than 650,000 Arkansans are family caregivers today, providing millions of hours of uncompensated care to their loved ones. AARP Arkansas has championed the Caring for Caregivers Act to establish a state tax credit for caregiver expenses. They've advocated for home and community-based services and partnered with local communities to deliver caregiver education and respite, moving us from awareness into action. And so I'm pleased to introduce someone who's been instrumental in this work in Arkansas, Ashley McBride, the state director for AARP Arkansas, who brings deep expertise and unwavering commitment to supporting caregivers in Arkansas. Ashley, thank you for your leadership.
Thank you so much, Lori, for that wonderful introduction. Good morning, everyone, and thank you to United We for the opportunity to join today's important discussion. I am Ashley McBride, State Director of AARP Arkansas. And today I want to briefly discuss Arkansas's caregiving landscape, particularly its intersection with work and financial security. I'll also highlight two policies that we're working on here at the state office, practical AARP resources that help strengthen financial resilience and better help provide better support and help for family caregivers, as well as ways that we engage locally. Let's begin with the size of Arkansas's caregiving community. Next slide, please. Arkansas has approximately 654,000 family caregivers, representing about 28% of the adults in our state. Caregiving can include transportation, meals, medication management, personal care, financial management, medical tasks, and advocacy. Many caregivers are also working. Regional findings indicate that 62% worked while caregiving. 37% are sandwich caregivers, meaning they have a child at home while also caring for an adult. And that combination concentrates the pressure on a family's time, employment, and finances. For working caregivers, that pressure often appears as missed work, reduce hours, stop savings, new debt, and leaving work earlier than planned. The economic value of this care is also significant. Family caregivers provide approximately 540 million hours of unpaid care, with an estimated economic value of $9.1 billion, or about $16.81 per hour. These numbers help us understand that caregiving is not only a personal or family responsibility, it's also an important part of Arkansas's health, workforce, and economic infrastructure. For employers, flexible schedules, telework where appropriate, paid leave, Employee Assistance Program or EAP, and caregiver support groups can help employees remain connected to their jobs while caring for loved ones. Also, we want to make sure that we note that in the US alone, 29% of US family caregivers care for both children and adults. But in Arkansas, it's 37%, which is about an 8% difference or an increase in the state of Arkansas alone. This is why caregiving, work, and household finances collide most visibly. This is where it happens. This is where our work at AARP intersects, and this is why it's such an important topic for AARP Arkansas. The next slide shows what this responsibility means for individual caregivers. The caregiving experience involves more than just hours of care. It also affects employment savings and personal well-being. Regional findings show that 57% experience a negative financial impact. Nearly 1/3 stop saving, and 24% use personal short-term savings. This work can be extensive. 48% reported high-intensity caregiving, while 29% provided 40 hours or more care per week or constant care. 36% received no paid or unpaid help. I do want to clarify that these are regional percentages and includes Oklahoma, Texas, Arkansas, and Louisiana. However, it's important for us to note that there are many caregivers in Arkansas that are being affected in the workforce due to having to care for loved ones while they're juggling work responsibilities as well as caring for their families. One potential policy response focuses on the direct expenses caregivers may face. Next slide, please. House Bill 1076, introduced in 2025, proposed the Caring for Caregivers Act. These were proposed provisions. The bill proposed a non-refundable state income tax credit equal to 50% of eligible caregiving expenses, with a maximum credit of $2,000 and a proposed maximum increase to $3,000 when an eligible family member is caring for a veteran or that veteran has a dementia diagnosis. Eligible expenses include home modifications, equipment, home care aides, respite adult daycare, personal care attendants, health equipment, and technology. The fundamental policy goal was to help eligible caregivers offset some of these costs required to support a family while staying at home safely. It's important to note that there are eligibility questions that come along with these policies, and we do address that as well. But the most important thing is that every year that this bill is not only proposed, but hopefully it will be enacted in 2027, that there will be an annual cap of $1.5 million. And we will want that to be first come, first serve for family caregivers to be able to receive the modifications that they need. And as that need increases, we will continue to go to the legislature and ask for an increase on that income threshold, as well as the statewide annual credit. The next proposal focuses on helping workers protect their own financial future. This is Arkansas Save, or the Work and Save legislation, which addresses access to workplace retirement savings. In 2022, approximately 52% of Arkansas private sector workers ages 18 to 64, or roughly 509,000 workers, lacked access to a workplace retirement plan. In 2025, interim study proposal described a state-facilitated payroll deduction auto IRA program for employers that don't already offer a qualified plan. Employees would be automatically enrolled, but could opt out if they so chose. The default contribution rate would be established between 3 and 6%, and the account would allow the worker from job to job to follow and use this contribution as they move to the next employer. Employers would not be required to contribute, assume fiduciary liability, or pay program administration fees. For caregivers, this matters because interruption in work and save can affect financial security long after caregiving ends. In Arkansas, this is about expanding access and portability, not requiring employers to contribute. The Small Business Survey helps explain the interest in this approach and the barriers employers currently face. Next slide, please. AARP surveyed 504 Arkansas small business owners and decision makers. The findings showed broad interest in greater retirement savings access. 79% showed a privately managed option, and 88% agreed that lawmakers should support it. Among businesses that did not offer a plan, 69% said they would likely be able to offer a plan if they were offered this option. The survey also identified why many businesses do not currently provide a plan. 60% cited cost, 44% cited complexity, and 33% cited the time required to operate one. A ready-to-go payroll deduction option is intended to respond to those barriers. Small businesses support greater access, but cost, complexity, and time remain barriers. Arkansas Save is designed to simplify that process. Policy is important, but caregivers also need practical resources they can use now. Next slide, please. AARP approaches caregiver support in 4 areas. We help plan with Prepare to Care and caregiver resource guides. We help people manage finances with budgeting, debt, housing, and caregiving cost tools. We help people connect through support lines, webinars, and community resource finders. And we advocate for practical policy and workplace solutions. We also encourage employers to consider flexible work arrangements and caregiving toolkits that help employees navigate their responsibilities. We are pairing those resources with accessible community engagement. So what that looks like on the local level. In November, we are creating a convenient pathway for busy caregivers. The Care Pit Stop, along with ShredFest, will connect caregiving support with document security and financial well-being. The goal is for every participant to leave with a clear next step, whether that is a caregiving guide, an event, a story sharing opportunity, or an advocacy action. These November activities are part of a broader local engagement strategy. Next slide, please. Our engagement includes the Caregiving Summit and a caregiving film that will be hosted in Little Rock this November, as well as regional engagement and a caregiving summit in the Delta, specifically West Memphis. In November, we have the pleasure of hosting the Caregiving Blitz, which provides a visible opportunity for resources and advocacy, as mentioned through our Caregiving Pit Stop, as well as deeper participation with our advocacy opportunities at the Capitol beginning in January of 2027, when our legislative session begins. We will be engaging with different audiences. We will invite deeper conversation, and we want people to share their stories about how being a family caregiver has impacted them. One resource that illustrates the practical side of our work is Making Sense of Caregiving Costs. Next slide, please. The Making Sense of Caregiving Cost Workbook is a practical guide focused on health, housing, and money management. It helps caregivers understand the financial impact of caregiving, explore housing and care options, identify community resources, and take care of their own financial well-being. This is the kind of resource that can turn a broad conversation about financial resilience into practical action and individual family caregiving. All of these efforts fit within a year-round strategy. Next slide, please. Our year-round approach to listen, learn, connect, act, and grow allows us to listen to caregivers and employers. We provide summits, workshop tools, and we listen where people are. We connect with our partners, our volunteers, and resources. We go to communities. We act through policy, advocacy, as well as our November Caregiver Blitz. And we grow through future plays, through the forums, our films, our regional opportunities. And ultimately, our goal is to help family caregivers remain in the workforce, protect their own financial futures, and connect and support before there is a crisis. Thank you so much for the opportunity to share all about AARP Arkansas and what we're doing on the ground to support family caregivers.
Thank you so much, Ashley. What great resources for Arkansas, and we hope that our guests today will take advantage of those resources. We appreciate the overview. As we've heard, supporting caregivers is not just about individual families, it's also critical to the state's workforce and long-term economic competitiveness. Mike Rogers, Chief Workforce Officer for the state of Arkansas, is here with us. Mike, I'd love to bring you into the conversation. From the state's workforce perspective, how does caregiving intersect with Arkansas's workforce priorities, and what opportunities you are seeing to keep caregivers connected to employment? Mike, take it away.
Well, it's a loaded question. It's so hard to answer with just a quick strategy. It's so complicated, but I'll start with kind of the high level side of what workforce looks like in Arkansas. And it began with executive order 3 years ago from the governor's office that helped to align some of the work, the outcomes, and all of the paths to resources to Arkansans by creating the workforce cabinet. The workforce cabinet consists of 8 different agencies, which would include the Department of Commerce, Corrections, Human Services, Education, Labor and Licensing, Shared Administrative Services, the National Guard, and Veteran Affairs. And the intent of having the workforce cabinet together was to be responsive and allow for people to come in to receive services, but to have one common intake, outcome, measurements. We obviously look at labor force participation rate, unemployment, and how do we create matches for the employers to find the talent, and not just in acquisition, but in recognizing someone's capacity and capabilities. And on the other side of how do we align the job seeker to find the career, the culture, and the employer that they're looking for. So we started off with, I had this idea making, just close my eyes and imagine what it would look like if we had a system that looked like eHarmony meets Indeed. How do we create these matches for people to be able to find career mobility, navigation, and determine what next steps are in their life? And so we started with developing out a system that allows for every Arkansas high school student to begin in career navigation and career awareness, to explore what are my aptitudes, what are my interests, what's my personality, what jobs would meet me, fit me. So in caregiving, it's primarily, from my perspective, an engagement. How do I choose this as a career? How do I choose to be able to enter into healthcare or counseling, mental health, and the different ways of serving through my profession? So that tiered approach would allow for Arkansans. We've seen through a partnership with Arkansas Healthcare Association that helps to represent long-term care facilities. We found a lot of our CNAs in these facilities were enrolled for about 11 years and at $14-15 an hour with no real path. And that's definitely a difficult job to be in and a lot of retention issues and things like that. So we started to develop pathways that would allow them to go from a CNA to medication assistant certified. And that provided $2.50 an hour delta on what they were making. And it showed a lot of the people that were employed in that occupation that they were able to learn and reskill and to get motivated, even though life was happening all around them, that they could still further their career through some very direct steps. And I was able to keynote at a graduation we had earlier this spring where the people, the folks that had gone through the CNA to medication assistant certified were able to get their LPN license. And we're looking at with the partnership and the nursing schools and the programs that we have while they're working to see 350 healthcare professionals get deeper, better, more pay, more engagement, and create this pipeline of talent that allows for us to be able to really help alleviate some of the shortages in healthcare, which may sometimes precipitate out to families providing caregiving. But the part that really excites me is that employers a lot of times are looking for innovative ways to be able to be employer of choice. And so we get a lot of conversations with different market sectors. Our focus centers and the area that we've really been looking at in Arkansas is who we are as a state, but advanced manufacturing, agriculture, the steel industry, aerospace defense, transportation, healthcare. There's a lot of different focus areas of industry sectors, but yet the employers that want to have a culture of advancement and being flexible. So there's a lot of different ways that I think that we're seeing some of the trending towards having a culture that allows for some accommodations and to make that flexibility a part of the day-to-day job whenever life does come at us. The last thing I would mention in terms of some of the initiatives Arkansas has is the governor has been, and today even in Jonesboro, is representing what communities are able to do in alignment with the state. And the initiative is called 1033. 1033 allows for the local nonprofits, community-based organizations to be able to have visibility of resources that, as we determine whether it's the 13 social determinants of health or 20 barriers to employment, that often elder care, child care, obviously a piece, but usually in every state it's transportation, it's affordable housing, food insecurities, educational attainment. There's a lot of different reasons why people have barriers to be able to advance their career or to even have a career. So the 1033 really helps to bring in a no wrong door approach that would be wraparound services for community to engage with state resources. And the thing that I am really excited about beyond those, the eHarmony Meets Indeed and the Love Connection, is this idea of how do I come into a place where I'm 6 clicks away from discovering what I need for the next 6 days, 6 weeks, 6 months of my life in terms of a state resource, a community resource, and bringing it all into play, because we know that on the internet, there's every answer out there, but navigating is hard. So we've got the formal product out that allows us to hide the noise, just get me where I need to go and start seeing options that I have and reducing that barrier of just not knowing how to navigate difficult situations. So those are some of the high level things that Arkansas is doing, and appreciate the question and for the long answer.
So great, Mike. Thank you so much. Love the explanation of Indeed meets eHarmony. But so many resources that you share that we hope our audience has learned about today. And also thank you for your leadership on this work too. It's just incredible what Arkansas is doing. I'm delighted to now turn the conversation to Jennifer Hallam, President and CEO of the Area Agency on Aging of Western Arkansas. Jennifer, your organization works directly with families across Western Arkansas. What are you seeing on the ground as people try to balance work and caregiving, and what supports are making the greatest difference? Jennifer, you're on mute.
Sorry.
Now we can hear you.
Let me try again. First of all, thank you for inviting me here, and I'm very excited about the discussion today because it's very needed. Area agencies across the state, we all and there's 8. So there's one in every area of the state. If someone doesn't know where their area agency locations are at, you can go to agingarkansas.org, and there should be one. You would go there and then you find some resources. But what my agency is seeing is an uptick in caregivers reaching out. Basically, as a caregiver, oftentimes the person who is caregiving, it may be a daughter, it may be a spouse, but they get overwhelmed, they get anxious, unsure of all the decisions that they have to make. That can lead to their health declining. And so we started caregiver support meetings, and we went from having one day a week to every day a week except for Sunday. We have caregiver support meetings where people can come in either virtually or we also have an in-person. If someone needs more in-depth, we do one-on-one to help them if it's kind of a situation where they're just not sure what to do. Maybe there's been a further decline. We're really seeing an uptick. And I would say my area and most of Arkansas has very rural components. In those areas, I would say that there's 25% of the population that is needing care, or even if it's just part-time or full-time care in the home. We have an aging population in some of those areas, and the resources sometimes are very limited. I would say that my agency and others, but we are aware of, and I'm glad he brought that up about the 1033. That's an awesome thing, where I can, someone is caring for someone, or they're doing some work with the family, and there is an organization that will reach out to me because I'm part of their network. Hey, there's a caregiving situation, or there is a transportation need. Can you help? And I would say this, that it's going to take all of us to surround not only our workers that are maybe trying to caregive, but also those that are doing this necessary and beneficial work. I would say for myself, I was a caregiver to my parents. And at the time when it first started, I had a four-year-old son up to a 12-year-old son. So it was quite the job to manage all of that. And luckily, I was able to talk to my employer and convey to them the situation. So they did allow me some flexibility, but I realized that there's others that don't have that. And so area agencies, and there's other organizations in your communities that we do want to help. And if that's transportation, if that's respite, if that's personal care, we are the boots on the ground for you, and we can find funds. Sometimes you will qualify for, like they said, the 2000. There's a guide program. There's different things that we look for all the time to help caregivers so that they can take their loved one to an appointment, or that they can find someone to sit with them while they do have to work certain hours. But I would say overall, we've known this was coming, but we have here and across the state experienced an uptick in those that are needing help, needing guidance, or actually boots on the ground.
Great, Jennifer, thank you so much. Appreciate the question that also appeared in the chat from Sherry of, will this recording be shared? That she would love to pass this on, to her employer, to others. And we love that. That's exactly why we're hosting this with AARP. So yes, we'll be following up, sending the recording along with other resources that our presenters have discussed today. So know that that will hit your inboxes shortly after today's session. The stories shared remind us that caregivers aren't a small group. They're employees, coworkers, managers, and leaders in workplaces across our state. As one of the state's largest employers, Tyson Foods has a unique perspective on supporting employees who are also caregivers. I'd like to welcome Carrie Clark. She is the Director of Workforce Strategy and Labor Engagement at Tyson. Carrie, why does investing in caregivers make good business sense for Tyson? And can you share any insights on policies or practices you are employing to support employees who are caregivers at Tyson? Welcome.
Well, thank you. I appreciate it. Good morning, everyone. That question, definitely a loaded question. One of the things when I was asked to talk and address the group, I immediately went into the perspective of what gets in the way of someone being able to come to work, stay at work, and ultimately staying with an organization. And that's something that we ask on a daily basis here at Tyson. And so when we think about that question in general, because caregiving is one of those things that we tend to think of as a personal issue until it starts showing up at work, and how it shows up, and it absolutely shows up. It shows up in absenteeism. It shows up in turnover. It shows up when a really good employee suddenly starts struggling to get to work on time, or they have to leave unexpectedly, or eventually decides they can't make it to work at all anymore. And so we see those absences, and a lot of times as employers, we just see that number. And so what we're really trying to do is take a step back and understand, we see the absence, we see the attendance points, we see the turnover. But one of the things is that there's a story behind every one of those numbers. There's a name, there's a person. And maybe it's someone who has a parent who can no longer be left alone at home. Maybe childcare fell through once again. Maybe they're trying to coordinate appointments for a spouse while working a full-time job. And maybe, as referenced earlier, they're part of that sandwich generation, which I always giggle because I think I've got jelly, peanut butter, and jelly, because you think about raising kids and then trying to care for aging parents. And then you add pets and everything else on top of that. And then let's not forget about the caregiver themselves. I mean, oftentimes we're exhausted, we're worried, we do everything we can just to keep the plates spinning, and you worry about when those are going to fall. We want to remove some of those barriers. So if you've ever tried to coordinate doctor's appointments, childcare, school schedules, especially today with school starting yesterday and today, work schedules, and everything that life throws at you, it's no surprise that life's not particularly interested in our Outlook calendar or an invite. So I've spent the majority of my career working in healthcare before coming to Tyson and moving into the labor relations and now workforce strategy space. So I've had the opportunity to look at people and work from a few different perspectives, and that's been the beauty of the job that I do here. One of the things that's remained consistent is that people's lives don't stop when they walk through those doors at work. And that can lead to distractions, that can lead to inattendance. And that's especially important when we talk about frontline workers. For many of us in a corporate environment, it's if something happens at home, we have lots of options. We can move meetings. We might work remote for part of the day. We might be able to step away to take a phone call. We may not like the disruption, but we have some flexibility to manage it. When we think about someone on a production line, like in our facilities or in a hospital or in retail or another frontline role, if their shift starts at 6, that shift starts at 6. They can't move production to 6:30 because mom has a doctor's appointment. They can't work remote because the babysitter canceled. And that's where something that feels like a very personal problem can quickly become a workforce problem. So when we talk about supporting caregivers, I don't believe the answers for employers to try to solve every problem in an employee's life. We can't. And I'm pretty sure nobody has the budget for that. But we can get better at understanding the barriers that affect our workforce and determine where it makes sense for us to remove some of those. Because if we can help remove a barrier that allows someone to come to work consistently, be successful while they're there, and ultimately stay with an organization, it's not only obvious it's good for the employee, but it's good for business. We're able to retain experience. We reduce the cost and disruption of turnover. We improve workforce stability. And maybe most importantly, we give one good employee one more good reason and one opportunity, and that's to stay with us. And it doesn't always require a huge new benefit or massive investment. What we're finding within our environment is sometimes it just simply starts with asking better questions. Like, what is actually getting in the way of someone being successful at work? And then we take a step back and look at the whole picture. We look at the employee, we look at the workplace, we look at the community around them and think about those resources. And is there already a resource in that community that could help? And I think that if there's a benefit that we're already paying for and employees may not know about, they may not know how to use that benefit. So, is there a gap that we can fill through partnership instead of creating something new or doing education that's already existing? One of the things in workforce strategy is that having a problem and solving a problem are not necessarily the same thing. We can create problems all day long, but if we're not addressing the actual barrier, then we haven't accomplished much. So that's where we're listening and having data come together when we think about the numbers in turnover and absenteeism and pinpointing where those occurrences happen. And if absenteeism or turnover is increasing, we don't just report the number, we ask what's driving it. Sometimes it's wages, sometimes it's leadership, sometimes it's transportation, childcare, financial stress, but sometimes it's caregiving. So when we understand the why behind the number, we can make smarter decisions about where to invest our time, our resources, and our dollars. And I think it's a huge opportunity that's out there in front of employers. Caregiving isn't simply an employee benefit issue, it's a workforce stability issue, it's a retention issue, and increasingly it's a talent issue. Because as our population ages and more employees find themselves responsible for children, parents, spouses, sometimes all three, sometimes everything in between, caregiving is going to show up in the workplace, whether we have a strategy for it or not. So if I could leave one thing, it would be this: don't assume you know what your workforce needs. We're uncovering new things every day in the space that I'm in. So we ask, we listen, we look at our data, we look at what's happening in the communities where our employees actually live, maybe not where the plant is, but where they actually live. And then we decide on whether we can realistically make a difference. We don't have to solve everything in someone's life, but if we can be there at the right time and remove the right barrier, we may be able to keep a great employee from having to choose between being there for someone they love and just keeping a job that they need. And so that's good for people. It's good for business. And because behind every attendance number, every turnover statistic, and every employee struggling to make it through a shift, there's a person with a life that's happening outside of work. And unfortunately, life doesn't care what time your shift starts. So when we think about those things and the resources, we really lean into our stabilization programs. We have some areas where we offer childcare. We have areas where we offer transportation services. We offer GED services. We have a plethora of programs that we offer our employees. And now it's really understanding where to target those and then partner with the community and resources such as everyone on the call. And how do we better understand those needs within that community so that we can fill that? Because if we stabilize the person, we can stabilize the business. So I'm sorry I didn't have slides to go off of. It really is conversation, and I've enjoyed this. I appreciate the time and allowing me to be on a soapbox that I'm so passionate about. So I thank you for that.
Thank you so much, Carrie. Practical, love the perspective of just asking the question, listening, to clearly understand what's happening. So really appreciate your perspective. And thank you for all that you do for Tyson's work. We want to conclude by just kind of wrapping up this conversation and bringing a final perspective. So we know that lasting change requires thoughtful public policy and collaboration across sectors. So we've invited United We is proud to partner with Dustin Brighton, principal at the 51 Group. So briefly, Dusty, can you just tell us, what should we be looking ahead for 2027? What are some issues that may be related to this conversation today?
No, thank you, Wendy, and I appreciate the opportunity to be here today. I think on the next frontier, so to speak, for the legislative cycle in 2027, there's going to be a lot of conversation. I'm sure you've seen it in the press. There will be a lot of conversation regarding the safety of children and how to better care for children, protect them, which I think obviously dovetails right into the conversation we're having today. So I think you'll see different policies and proposals on that front coming out of the legislature. We'll be paying very close attention to those and looking for opportunities where we can talk about making it easier for working families. So our eyes are peeled on that. The good news for Arkansas is that we're in a pretty good place financially right now as a state, and there can be some ways to possibly pay more attention. Not that we're not doing enough, but pay more attention to some of these issues and making it easier for people to be employed, but yet still take care of their loved ones.
Thank you so much, Dusty. There's a lot to look forward to in 2027, and this conversation today definitely helps frame that. We are at time, so if you have a question, we would be happy to follow up with you. Drop it in the chat, and then we'll follow up with you separately. I want to thank again our esteemed panelists joining us today, and to AARP for sponsoring today's forum. On your screen, you'll find information about AARP's resources. We encourage you to scan the QR code to learn more about the tools and support available. And we invite you to stay connected with us. Our next Caregiving at Work forum will actually take place live from Washington, D.C. on September 16th. And you'll find some information about that on our website. And we'll conclude and complete a list of today's resources in our follow-up email along with the recording, so you can share that with your employers, caregivers, and other families to stay engaged and connected with the tools and resources that you've heard about today. Thank you so much for joining us, and enjoy the rest of your day.